You are now at the weeks of gestation where we would offer the testing for Group B strep. What Group B strep is it is a bacteria that usually lives in the human body. It lives in the rectum part of it. It doesn't usually have an effect on the carrier of it, the mother, or the during pregnancy. But it can get into the vagina, where it can then travel up to the uterus and up to the amniotic sac, where it can get into the amniotic sac and get to the baby, and from there it can cause problems. It can also, if it's in the vaginal tract during birth, then it can also cause problems for the baby. The baby can get early onset Group B strep disorder, which for most cases it can occur between 12 and 24 hours, but up to 7 days is when the early can happen. The worst case scenario if a baby becomes infected with Group B strep is that they can develop meningitis and pneumonia, and it could lead to death. It doesn't always get that severe, especially if it can be caught early, but for the most part we like to try to avoid any of those complications. And so because of the severity of what can happen if the baby does become infected with this, then we do offer screening at this time. And so what that screening consists of is we give you a swab, and we can do it for you if you want, or if you'd like to do it yourself. But you open the skin up so that you have direct access to your vagina, and you take that swab and you put it up as far as you can go. You swab it and you bring it straight out. Try not to touch any of that outer skin, and then you put it into the tube that comes with that swab, and then we send it off for testing. In the event that that test does come back as positive, then there are a few different options that we can do. The most common that we use are in labor. Then we will give you an IV antibiotic. The IV antibiotic for that is usually amoxicillin. Is it amoxicillin? Sorry. Sorry, it's ampicillin and penicillin. The research has shown that the use of these has greatly decreased, almost to non-existent, the occurrence of the baby developing a Group B strep syndrome after birth. If you would like to not do that, that's not our biggest recommendation, but we of course will support you in not getting that if you don't want to. The other options are that you will do a risk-based approach. The CDC has said that it's not as effective, but some things that you can do are you can use you can insert some garlic up into your vagina to help kill any of that bad bacteria that's up there. One of the things that's contradictory of this is that you have to do it for several weeks leading up to it, and even then it hasn't been shown to really decrease the risk of your baby getting this infection by much. Other things are probiotics, the use of HEPA-Cleanse, and those are the main factors. In the event that this test doesn't come back positive, and so there are no other factors that would make you at risk for it, then we would just provide you with the information postpartum to look for in the event that your baby does start to develop something, because this test can only tell us what it is right now. It can't tell us where you are in the future, but usually with us testing now, usually that's a pretty good indicator of where we will be at the time of birth. Do you have any questions about this?